So we're going to go ahead and continue where we've left off on the last examination, where we were assessing the nares, assessing if there was any discharge, and if so, what was the character of it? Was it thick? Was it thin? This could indicate very well if this could be somewhat of an allergic reaction to some allergen, or if this is actually an infection where you would see maybe greenish, more yellowish, thick type of secretions as opposed to watery, thin, transparent secretions as in allergies. Now, we also want to see the amount of it. The color of it, like I stated before, is it coming from one nare or both nares? So we want to take note of all those different things. Now, next thing we want to do is go ahead and palpate the bridge and soft tissues. Now, we're going to ask the patient, do you feel any tenderness when I do this? Do you feel any swelling? And you're also going to be testing to see if there's any masses or displacement of cartilage or bone anywhere. So do you feel any pain or tenderness when I touch down here?
No, ma'am.
No, and he doesn't. Now, if they did, this could very well be maybe an accumulation of secretions. It could be inflammation, swelling that could be causing that tenderness, which would warrant further assessment. Now, nasal patency. That we also need to assess. And the way that we assess nasal patency is what I'll do is I'll go ahead and as he's breathing, I'm going to tell him, go ahead and keep on breathing. And I'm going to go ahead and close off gently one nare. And I'm going to hear. Is there any gurgling? Or do I see that it's noisy? Is it easy to pull air in and out? So I don't hear anything. It seems like he did fine with that. And then you would do it again with the other nare to make sure that he can breathe well when you do that and it's noiseless. Now, moving forward to the nasal cavity. Now, using the nasal speculum and the light, we want to observe three aspects. Now, I want to note that we do not want to touch the septum when we are using the speculum because it is extremely painful, so try to avoid this at any costs. Now, I'm going to go ahead and ask him to face me so that I can perform this. Now, I'm going to have him tilt his head back so that I can take a look at his nasal mucosa. And I'm going to look here with this nasal speculum, and I'm looking here for any discharge, any masses, lesions, or swelling of the turbinates. And here I'm seeing nothing. I do see that on the outer third portion of the nasal mucosa there is hair there, but that is a normal finding. Oh, I see, and I just touched this. I just touched the septum. Sorry. So, what we want to see that deep within, that we see that the color of the nasal mucosa is a deep pink, and that it is glistening, which it was. It's a very clean nose. So, moving forward. We want to also assess the nasal septum when we're looking at the nose through the speculum. We want to make sure that it's close to midline, okay? So when I move it up, I want to make sure that this is, it's never going to be absolutely perfect in most people, but you know what? You want to make sure it's close to the midline and that it's straight. You don't want to see any perforations, bleeding, or crusting anywhere. Now, as far as the sense of smell, the sense of smell is the sense of smell is mostly determined by cranial nerve 1. Cranial nerve 1 is the neuron that goes ahead and transmits that information over the brain for interpretation. This is where the different vials with different odors come into play. Since we're not going to do this at this point in time, I will only mention that. Now, next we're going to go ahead and assess the sinuses. Now, we want to go ahead and inspect not only the front, but we also want to assess the maxillary sinus areas. So in order to palpate the frontal sinuses, we want to go ahead and press the thumbs under the bones on each side of the nose. So right here, we're going to go ahead and just palpate right here. And if you'll see here, this is what we're palpating. And we're seeing if he has any tenderness or pain when doing this. And then we want to go ahead and go underneath the zygomatic process and go ahead and palpate here with our thumbs as well, feeling for any edema, pain, or tenderness as well. Now, if the patient states he does have a swelling, and it is tender and painful, it could be from a possible infection or possibly from an obstruction. If this is something that a clinician is pointing towards, then what we want to do is we want to further assess that by transilluminating the sinuses in a darkened room. So just like I had stated in a previous video, we want to go ahead and darken up the room. And what we'll do is we'll go ahead and take our light, and what we want to do is we're going to go ahead and transilluminate those two sinuses. And if they are opaque or dull secretions, if they're opaque when we transilluminate them, it's because there are a lot of secretions in the sinuses. Either that, or there's a congenital abnormality where they never developed. So those are things to look for. And as you can tell, whenever you're transilluminating something with fluid in it, it will come up a red glow. And that's what we're looking for in the sinuses, a red glow, just like you see here. So that is what we would do in a case where we were presented with a possibility of having an infection in the sinuses. So now we'll move forward to the mouth, oral cavity, and oropharynx assessment. So when we do this, we want to start off with the lips. So let's go ahead and face the camera once again. Now when looking at the lips, we want to check the color, the symmetry, if there's any edema there, any lesions, because remember there are a lot of different disorders that produce lesions among the skin, and especially in the lip area. And you want to also check if they do have lesions, if there's any discharge and what it looks like. But normally the lips look a pinkish color, they're symmetrical on both sides, and then they should be smooth as well. Okay? So now, next what we're going to do is we're going to go ahead and ask our patient to go ahead and clench his teeth and smile for us. Now, when we do this, we are testing cranial nerve 7, and we're observing what they call tooth occlusion. Now that is where we have interdigitation of the upper and lower molars. Go ahead and try that again. Of the upper and lower molars and the premolars and canines. So we want to make sure they sit in the right spot, which they do here. Okay. Now, moving forward, we want to examine the buccal mucosa, the gums, the teeth, as well, using a tongue blade and a bright light. So we're going to go ahead and use this bright light here. And we're going to use the back of this fork here as our tongue blade. So what we want to do is, go ahead and face me. What we want to do is assess the mucous membrane first. So we're going to go ahead and ask him to open his mouth. And then we're going to check to see the color of the mucosa. And it should be a pink reddish color. And it should be smooth. It should be moist, which it is. And there should be no lesions anywhere. So you want to make sure you really sit the tongue back and you really press on it so you can take a look at the back of the mouth and along the sides here. And I don't see really any lesions anywhere. It's a nice pink red color. And then also when you're checking this, you also should check on where the Stenson duct is, which is one of the glands, salivary glands. And it should look like a white protrusion near the second upper molar. So we'll go ahead and try to do that and try to look for it. Okay, and yep, I can see it here on both sides. Okay? Now, since we've checked that, now we're going to go ahead and check the gums. So when we check the gums, we want to make sure they're stippled and that they're pink, such as they are here. Which is a normal finding. You want to make sure that they are that there is a clear tight margin around each tooth. And as you can see here, there are. You also want to check that there's no inflammation, swelling, or bleeding from the gums either. And then when you have a couple of gloves on, you're going to go ahead and palpate the gums. And what you're doing is you're checking for any induration, thickening, masses, tenderness, lesions anywhere. So you would really get further back along the sides and underneath, trying to check all of the gums as well. So we're going to go ahead and stop here with this video. We're going to continue with the next one, starting on the oral cavity. So tune in on the next video.